Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 243rd episode, we have a special show with CEO and fractional growth officer, as well as podcaster, Dr. Roxie Mooney, also a first-time guest. Welcome to the show, Roxie.
Thank you for having me here, Justin. It's great to be here.
You got it. And we first met this past HIMSS, I guess in February or March, actually, through a mutual friend, Mike Mosquito. And ironically, Mike was my guest last week. So obviously a phenomenal personality. I know we both think highly of him and certainly would love to talk about him a little bit later on as well. But I thought HIMSS 22 was just an awesome, invigorating show. Great to be back in the saddle. But what are your thoughts on the conference?
Yeah, I mean, I think that, just these conferences that we've had early this year, there's just been a whole new energy and enthusiasm, I think, just for that face-to-face engagement that we've so desperately missed out on in the last couple of years. So I think that we're just really excited to be around people again. So I definitely thought there was this new energy, and it was just really, really wonderful. There's also, some things that I think about HIMSS when I think about the conference. I'd love to see them go further in future years of really just reinventing the conference, reinventing how startups and the corporates kind of engage with one another at the conference. I think that's going to be really key going forward, to be able to bridge those two audiences more cohesively together. And I think the conference has a unique opportunity to facilitate that.
Yeah, I completely agree. And I think we talked about this, back in March when, HIMSS is really known. It's known for a lot of collaboration and obviously trade show and conference floor. And we walk it and we see lots of people that we haven't seen in maybe a year or two or three, but also educational sessions. And so, and they've got to make sure that they double down, because that is kind of their claim to fame, is the CMEs and the CEs and all that. We've got to make sure that education is paramount, because that's what they're known for. They're probably the best at it, or one of the best, certainly from a broad perspective, maybe not deep into a specific vertical, but from a broad perspective. So I completely agree. I think taking a step back and looking at what do they want to be, in this next evolution, just don't keep HIMSS going as it was. I think I totally agree. Rethink it, relook at the business overall.
Yep. Absolutely. Such an incredible opportunity to reinvent themselves.
Completely agree. I mean, they have a great brand. And it's time. So speaking of, brands and brands that are building, you went to Vive. I did not make it. I think it was a bit much for me back to back. And I had I think actually a board meeting. I'm sad I missed it, but you went to Vive in Miami. So how was that?
That was my first conference face-to-face this year. And so I think that was even a whole unique energy. Of course, being in Miami, I think it's kind of hard to have a conference that doesn't have a distinct energy when you're in Miami. But the conference itself just was very innovative and very fun. Just the attitude or feeling of the conference, to me, really embodied what you would expect in healthcare innovation. So I'm really excited to see what that team has to bring to market in future years to come.
Yeah, I completely agree. I've not made one, but I heard phenomenal things from you and from others that attended HIMSS just a week later, going, yeah, that conference was awesome, great innovators. It doesn't take anything away from HIMSS, in my opinion. So we're not saying, it's just another conference, and we need these energetic conferences, and these conferences focus on different aspects of the business, different people. So we actually get to collaborate and meet new people. So it's awesome. What about HLTH, or Health, in Vegas? I think it's going to be September of this year. Will you be at that?
Yeah, I will. I actually applied to be a speaker there. So we'll see in the next couple of weeks if I was selected or not. I was a speaker at HIMSS. So speaking of education,
Yep.
and, so I'm hoping that I get selected for health. And I think, kind of like what you're saying, there's tons of healthcare conferences that are happening these days. There's probably multiple conferences happening every week, both
Yeah.
virtual and in person. And I think, each one has something to offer just differently. And so HIMSS, Vive, and Health, I still think all bring their own unique value. And I'm looking forward to it. I think health is going to be great this year.
Yeah, I agree. And I'm certainly going to attend. I'm actually going to broadcast my radio show from there for at least a day. It'll be my first health conference, but I think conferences in general, I'm a strong proponent. That was my 22nd HIMSS that I attended. And I'm a big just proponent of us getting together, us collaborating as a healthcare community, as innovators, thought leaders, strategists, and just and leveraging each other. And that's what those conferences do. We get to meet new people, maybe find a mentor, maybe find someone to mentor, and it's just a great opportunity to enlarge your circle, your influence, your education. So, and to what you just said, these conferences do come at us pretty quickly now. A lot of them we've shifted virtual, so a lot more people are kind of jumping in the game. But we have some mainstays
Yeah.
like HIMSS and obviously HFMA and health. And health is a newer one, but I think they've been around for at least 4 or 5 years now. So they're not new
Yeah.
anymore. So yeah, cool. Well,
Yeah,
my
absolutely.
my audience has not heard your voice before, so before we get too much further, tell us about you. Where'd you grow up, college, live, all that good stuff.
Sure. So I grew up in NOLA, New Orleans,
Love it.
Louisiana. So that probably says a lot about me, right?
Energetic.
So yes, exactly. And I like to have a good time. So I grew up in New Orleans. I moved to Orlando, where I live now, in 1999. So I kind of feel like I'm almost an Orlando native, believe it or not, as well. And grew up in New Orleans, went to school there. I started college there, but I really took on my academic experience much later in life than most people. I was a young mom. My daughter's 30 now. And I went to college in my late 20s and in Florida. So I got my bachelor's degree in organizational communication from Rollins College. I went back and got my master's degree in organizational leadership from Palm Beach Atlantic. And then I ended up getting my doctorate in business from Walden University, which is an online global school.
That's awesome. Very
And
cool.
yeah, I've been living in Orlando since '99, and I love it here.
Yeah, as you know, we discussed this during HIMSS, but I bought a place just recently in Sarasota, and I'm there probably once a month or so. But I love Florida. I have another place in the northern part of Florida. I'm a resident of Florida, and I just love the energy. You emulate a lot of it, but certainly just people with good spirits. What I love about another aspect of Florida, certainly Sarasota, is a lot of people are retired, so they're usually in good moods, or people are on vacation, so they're usually in good moods. And so you have people around you, they're always in a good mood. Orlando's probably not too far off because people come from Disney World, and they're in good moods usually. So.
Yes, exactly. Yeah, and ever since the pandemic, there's always been a huge influx of people moving to Florida, but since the pandemic, where people aren't really tied to their physical jobs anymore, we're seeing that double and triple.
Yeah.
So there's just so many people coming to enjoy the blue skies and sunshine and beaches.
So true. So where does your passion for healthcare come from?
It's interesting. If you asked me early on in my career if I wanted to be in healthcare, I would have said, heck no. I'm much more of a purple cow, sign upside down kind of person. And, years ago, healthcare was just way too traditional and conservative for me, with my marketing background. But early on in my career, I ended up working with an entrepreneur with 5 healthcare brands. And this was in the early 2000s, before the Affordable Care Act. And we started doing some really revolutionary stuff around pay for performance way back then. And it just really gave me a taste for healthcare. It got me really excited about it. And I started to kind of uncover this transformation that was going to happen in the industry. And so I started thinking that the industry would be more open and more in need of some of the marketing practices and branding, go-to-market strategies that I had been applying in other industries for a long time. I thought healthcare would start to be open to that. So that's when healthcare really started to become appealing to me. And then, I just kind of started digging into it over the years. And, I can't imagine being in any other industry.
Yeah, I completely agree. I've only really known healthcare. I got into it right out of college with a company called HBO and Company that turned into McKesson. But I dabbled outside of it a little bit after we sold Greenway. I stepped into some of the industries, but I didn't have the passion for other industries. And unfortunately, I wanted to. I was like, I should try things and expand my horizons and go from there. But, to your point, there's a lot of need in healthcare. I understand it. I love it. I have a passion for it. I thrive in it. So, and unfortunately, I bring up a topic, we gave some outlines during HIMSS when we met, but, something I just read in the Wall Street Journal yesterday morning is how there's a band of schools. So I actually flew to Dallas yesterday for a meeting, and I brought this up during the meeting as well. So this is relevant to you. I'd love to get your opinion on it.
Sure.
There's a group of schools that are coming together to ban the word obesity from their vernacular because they feel it's offensive. And I'm just like, I just read that. I'm like, oh my gosh. So I'm in healthcare. So I have a very unique, and so are you. So we have a very unique perspective. We know what overweight and obesity does to your body, to your energy, to your health overall, certainly to the finances of our country, because it's the biggest cost. Managing diabetes is one of the biggest costs in our healthcare system and growing every day. But 66% of our population today, or 67%, is either obese or overweight. And so to almost not educate on that and take that out of our curriculum, I was just shocked. I would love to get your initial thoughts on that.
Oh my goodness. I think that's a horrible move. I'm sure it's not a clinical diagnosis,
Right.
but there's so many clinical implications around that it almost it almost takes away from the negative consequences of that. So, I definitely understand that there's a lot of a negative stigma and has been for a long time around obesity and around being overweight. But I think that we see more and more the negative healthcare implications of that. And so it's not about how you look, but it's about how healthy are you? We're in quality of life and length of life. So I think that, gosh, that's kind of going backwards and instead of the direction that we need to go in.
Yeah, I completely agree. And we don't want the stigma, and we don't want the negative ramifications of what it could bring to society from a physical perspective. But everybody that I've spoken with, and a lot of my friends, they've kind of buoyed, they've lost weight, they've gained weight, but then they've lost weight. And I was actually with somebody yesterday who's, I think, lost 45 or 50 pounds. Everybody talks about energy, happiness, more joy, just how you get up every day, you feel better. And other costs in your life will probably drop too, if not drop dramatically. Certainly your long-term costs that you pay personally, the country will have to contribute. There's just so many benefits to, recognizing the issue and then wanting to address it. And so that's the kind of piece I'm like, I want you to feel as good as I feel, because you can. I truly believe you can.
Right.
So anyhow.
Yeah, absolutely. And taking the language out of schools, I think just perpetuates the stigma around that, as opposed to moving in the direction of, let's talk about it, let's bring greater awareness, and let's kind of, link arms and kind of figure out how we can, address this together.
Yeah, tackle this together. And I'm speaking from experience. I lost 30 pounds now from when I left when we sold Greenway, and I took time off and really decided, you know what? Wasn't the healthiest lifestyle. I was working a lot. I get it. We all have to work hard. But I just reprioritize it. Now we're working almost full tilt again, or I will be here shortly. I'm going to keep this mainstay. Like, I rearranged my schedule so I can, work out every single morning. I still get family breakfast and all this kind of stuff, but I am not going to ever let my health go again. Just because the difference that I feel, even my health and my healthcare costs. I mean, that's to be honest, my healthcare costs have dropped. I'm probably one of the only people in the world dropped by 60 to 70% when I decided to become a healthcare consumer and lose weight and manage my healthcare.
Yeah.
So I pay less today
Wow.
than I ever have in my life by far. But we kind of digressed a little bit.
Well, and I will
Yeah,
say
please.
I've been kind of blessed genetically to where I don't struggle with weight like a lot of other people. I have a really high metabolism, but I would say that, even if I've gone through seasons where I might look thin, but that doesn't mean that I'm healthy.
Right.
That doesn't mean that I have that energy. And so you're right, being able to put those healthy habits in place is so important for us to be able to do all the things that we were created to do.
Amen. Amen. And I know
Yeah.
my producer's gonna be really happy because I talked about something controversial. Years ago, she's like, "You should really interject controversy into your show." And I'm like, "It's just not who I am. I'm more of a collaborator, and I like friends and love and all this kind of stuff. So I'm more that side of the business than controversy." But she'll love this piece of the segment. So
Awesome.
learning more about you, and again, for anybody that's joined us late, my special guest today is Dr. Roxie Mooney. Where do you primarily focus your time and efforts?
So everything that I do these days is really rallied around addressing this single business problem that really started with my doctoral journey.
Mhm.
So when you're getting your doctorate in business, it's a very practical degree, and so you're addressing a business problem. And for me, I come across this statistic that 95% of innovations that are brought to market fail. And that's not just in healthcare. And so when you think about the regulatory issues and the reimbursement misalignment that we have, what would be our success rate or failure rate in healthcare is just, it's scary. It's alarming. And when you think about trillions of dollars being poured into the healthcare industry and this large failure rate, I scratch my head and I stay awake at night trying to figure out, like, well, how are we going to really fix the healthcare system if most of these innovations that are being brought to market fail? So that's kind of put me on this very purposeful, missional journey of being able to understand what are those strategies and tactics that health innovators need to be successful, and what do they need to avoid to make sure they don't fall into some of those pitfalls. And so I developed a lot of strategic models and strategy frameworks that I help with health innovators and mid-market corporate, kind of developing those innovations and bringing those to market. And, I have my podcast show, the Health Innovator Show. I also published a book, How Health Innovators Maximize Market Success. All of these are just things that I'm doing, resources, education, speaking, joining you here today, Justin. Everything is really tied to how can I share some of the insights that I've gleaned from the work that I've done to help people be more successful, so more innovations can get into the hands of the people that need them.
I love it. And I knew we were going to have a good show, and we met at HIMSS. I could just tell because your experiences are they're so perfectly aligned with some of the things that I've done as well. So I can't wait to dive into that conversation, because I had a little TED talk 2 weeks ago with HFMA, and around one of it was innovation, and then the other one was on imagination. And the innovation one, I talked about how and why 90% of companies fail. After my Greenway world, I joined Georgia Tech's incubator, and I spent a lot of time with. It's a phenomenal incubator. Not saying it's a great incubator, but I've met a lot of entrepreneurs, hundreds of them, because they have different levels. And I mainly worked with their top 15, certainly healthcare groups. But when you meet 250 innovators, you get a good. I did it for a year, and I was able to strategize and listen to their ideas. And so, it gave me a very unique perspective on why the stat is real. Even to this day, 90% of entrepreneurs fail. And so I got an inside glimpse of that. And it was new to me because I was very fortunate. A couple of my companies, HBO and company McKesson, and then Relay Health and Greenway, all did very well. I had never, I was very fortunate because people around me were good. So walking into, other situations that were not as positive taught me a lot. So I can't wait to dive in to that piece. But one thing you brought up, well, let's go ahead and dive in. So what are some of the tenets that you speak on and that you feel are, you can help people navigate those success in failures?
Yeah. So there's a couple of things that really came out from my research that I did. So the number one reason why innovators fail is because there's no market need. Now, Justin, we could talk for hours just on that one topic.
Yeah, for sure.
You've got thousands and tens of thousands of entrepreneurs that are just brilliant, that have all of these incredible ideas that they want to bring to market. But too often there's no market need for what they're so passionate about. And so I think being able to vet that or validate that, test that hypothesis one way or another up front is just so critical. Because, from your experience with entrepreneurs, I mean, we put our heart and soul, everything into these companies, into these innovations that we're building and that we want to bring to the world. And, how gut-wrenching and heart-wrenching it is only to find out that no one wants what you have.
Certainly at scale,
Or maybe a handful of people want it, but not enough to create a viable business around it. Or it's kind of more of a nice to have as opposed to something that I need right now and that I'm looking to solve for right this moment. And I think really key is willing to exchange dollars for, because a lot of times people say that they want something, but when it literally comes down to it, they're not really going to pay for it.
Yeah, mission critical. I think that was something I've always made sure my companies are mission critical. You cannot operate without this. You certainly cannot optimize your business, but most importantly is mission critical. So yeah, I completely agree. And that nice that you mentioned it. I mean, having something that a few people want, but is a true market need where you can scale. But also there's also a difference, building a good lifestyle business. So you don't have to, not everybody has to build, a $500 million or $1 billion, multi-billion dollar company. Everybody wants to, but you don't need to. So there's also a side, hey, can I build a widget that can work enough, solve enough problems, make it a good lifestyle business? And that could work. And so but then you got to be careful how much money you raise, because you want to be very honest with your investors going, yeah, I did market research. We can probably build a $20 million business or a $30 million business or whatever. And that's okay. But that's fine, but be very honest, do that research. Like you said, just don't go raise, 10, 15, $20 million for a $20 million, opportunity, because it's not going to bode well for anybody. So.
Absolutely. Well, there's just so much inherent bias that we all have as human beings that kind of blind us, because we experience the problem firsthand, which is how a lot of innovators get started, that we believe that, the rest of the population or enough of the population also experience that problem in the same way. Or, we ask, I love talking about how, I asked my mom and she said it was a great idea. so we should do this. I validated it, or I asked my friends. And so just being able to vet those biases along that process, I think is really important.
Yeah. And so what's the second, the single most important factor when, innovations succeed? And you mentioned market, having market share, but anything else you want, maybe a follow-up on that or another item?
Yeah, absolutely. So, so we talked about the one reason why they fail is because there's no market need. The single reason why they win, why they succeed is product market fit.
Yep. Yes.
And, I know that that's kind of an elusive term. We kind of have different ideas of what that means and how to achieve it. I define it as, when you have a few customers, that's not necessarily product market fit. It's when you have enough customers to where at least 40% of your target audience would care if you stop selling your solution.
That's a great point.
And that's a really, really big difference. And so there's all these places on the continuum between, identifying market need and then being able to get to product market fit. And these are things I think that in the healthcare ecosystem around innovation, we don't talk enough about these phenomenon. We talk about AI and blockchain and
So true.
all the sexy buzzwords, but we're not having enough conversation around the business strategy or commercialization strategy that is just so critical and foundation for all of those other sexy buzzwords to actually be successful.
Yeah, and looking out beyond, you bring up excellent points, and also looking beyond your product, because your product could be a niche and you could solve a problem for this, but then how does it integrate into the overall, for us, like care strategy? Like that's always big. When I talk to these entrepreneurs, how do you affect their workflow? How do you integrate or optimize their current workflow? You can't just you can't create they just jump into this app or just jump over here. No, they're not going to do that. They can do that in a test mode, once or twice, but they're not going to do that with 50 patients a day. If you're, a physician or a nurse who sees 150 patients a day, or, it has to be integrated into their workflow. However,
Yeah.
I'll give you the last, 10 seconds, but I know we're going to have a great show. I'll have you back next week to follow up this conversation. But, any parting words just from what I just said there, Roxie, before I close the show?
No, I think that's a great ending. It's been great to be here. I've thoroughly enjoyed the conversation, and I look forward to talking more.
Yeah, I knew you'd be a great guest. I'm glad we have time scheduled for next week's show, and maybe we even do a follow on. I know that I'll join your show as well. I knew we would have a great discussion. But thank you so much for joining me today, and I truly appreciate you taking the time out of your busy schedule to join Roxie. And thank you to everybody for joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all my shows are posted at Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check out some of the updates we launched on justinbarnes.com. Thanks, everyone, and stay safe.